Hello, and welcome to Dr. Mercola's Cellular Wisdom, the show that uncovers the hidden powers of your body's smallest superheroes. I'm Ethan Foster, the guy who's always ready to notice the elephant in the room and then politely offer it a seat.
And I'm Alara Skye. I'd say I'm Ethan's comedic partner in crime, but trust me, my cunning sense of humor is far more heroic than criminal. So, let's get right to it, shall we?
Indeed. Today we're venturing into the world of blood pressure, specifically why so many of us don't realize we have a ticking time bomb in our arteries. Then we'll see what vitamin D has to say about that, because apparently sunshine and a little supplemental strategy can bring those numbers down.
Right. Nothing says, I'm on top of my health, quite like discovering you've been calmly walking around with the silent killer. Over 120 million American adults have high blood pressure, yet a huge chunk of them, and by huge, I mean nearly 58%, don't even know it.
That's an impressive form of blissful ignorance, but we can't exactly blame folks for not being aware. High blood pressure doesn't exactly wave a big red flag that reads, "Danger, heart trouble ahead."
True. It's more like your arteries have decided to audition for a pressure cooker commercial, and nobody told you until the steam started whistling.
And if you look at the numbers, about 83.7% have uncontrolled high blood pressure. That suggests we have a national hobby of ignoring the quiet warnings.
Precisely. Some people go to the doctor thinking they'll get a gold star for staying off Google for once, only to be told, congratulations, your BP is off the charts. And next thing you know, there's talk of diuretics, beta blockers, or some complicated combination designed to calm those pipes down.
But there's also a cost for that route. Side effects like dizziness or fatigue, and ironically, you can get so wiped out by your medication that any motivation to exercise kind of disappears.
Which is a shame because exercise is one of the best ways to help reduce blood pressure in the first place. So we end up chasing our tails. We take medication, we feel too sluggish to work out, and we stay on the medication.
Doesn't it just warm your heart when the solution to a problem creates a whole new problem?
That's the cycle for many folks. But Dr. Mercola has been highlighting something more encouraging. This notion that vitamin D plays a big role in keeping those numbers in check, especially for people who are older or overweight.
Right. There was a study featuring adults over 65, all with a BMI higher than 25, who took vitamin D plus calcium. And guess what happened? Their systolic blood pressure, also known as the top number, took a dive.
If I recall, they had about 221 participants. Some took higher doses of vitamin D, some slightly lower, but everyone also got calcium. Apparently, these folks saw real improvement, particularly those who were heavier or already dealing with hypertension.
A typical person in that study experienced a drop of around 3.5 millimeters of mercury in systolic and 2.8 in diastolic. But in the higher dose group, it was around 4.2 systolic and just over 3 for diastolic.
Now, 3 or 4 points might not sound like a blockbuster victory compared to your daily dose of superhero movies, but trust me, when your body is the battleground, every tiny reduction counts. Just a few points can lower your risk of heart issues.
That's true. And these changes were sustained for up to a year, which is longer than the average shelf life of my New Year's resolutions. So, that's pretty impressive.
And let's be honest, some people like to measure health results in micro-weeks. I took 2 vitamin D supplements. Why isn't my blood pressure perfect? But this study showed consistent improvement over 6 months and then a year.
It's the good old slow and steady approach. Best part is that vitamin D is something we can manage naturally. Sunlight is free and widely available, at least if you step outside at the right time of day.
Right. But there's a catch. If you're loading up on seed oils, you'll want to be cautious about soaking up midday sun. These oils contain high amounts of linoleic acid that can break down into nastiness under UV light. If your body's loaded with those oils, you might get more damage from the sun than you bargained for.
So, let me get this straight. The sun is your friend if your internal environment is up to par, but if you've been binging on deep-fried everything, you might be inadvertently turning your skin into a chemical experiment.
Bingo. It's like painting your skin with something that's going to get scorched quickly. Reducing seed oils for at least 4 to 6 months helps rid your system of excess linoleic acid. Only then can you comfortably enjoy a moderate amount of midday sun.
So, if I do that, I can catch some rays without feeling like a vampire emerging at noon?
Precisely. Just don't skip your common sense. If your skin starts looking even the slightest bit pink, it's time to retreat from the sun, no matter how good that vitamin D might be.
What about folks who live in northern climates? Some places see the sun as often as I see flying pigs. They might have to rely on supplementation, right?
Yes, especially if you live in the land of long winters. That's where vitamin D3 supplements come into play. But you can't just guess. Getting tested twice a year to keep your levels in the optimal range, somewhere between 60 and 80 nanograms per milliliter, is the best approach.
Now, I've heard about vitamin D2. Should folks go that route?
Not if they can help it. Vitamin D3 is more potent at raising your blood levels, whereas D2 just kind of shows up and says, I'm here, but doesn't do as much. So, if you're going to take a supplement, it may as well be the effective version.
I do love a supplement that actually does what it's supposed to. That's revolutionary.
Revolutionary indeed. And the story doesn't stop at D3. Balancing it with magnesium, vitamin K2, and even calcium can create the perfect environment for your cardiovascular system. It's like hosting a potluck. Everyone has to bring something different but complementary, or you risk throwing the entire meal off.
That's a neat analogy. If you invite only one friend, the party's a flop. If you invite the right mix of friends, magnesium for muscle relaxation, vitamin K2 to direct calcium where it needs to go, and so on, you have a proper shindig for your arteries.
Exactly. Vitamin D helps your body absorb calcium, but vitamin K2 helps ensure that calcium doesn't wander off and deposit itself in your arteries. And magnesium helps everything run more smoothly, including muscle function in your blood vessels.
It's a full house of synergy. But let's step back for a second. So many Americans have high blood pressure, they're overweight, they may not know they have it because it's typically silent, and standard medications can lead to new issues. Meanwhile, a natural non-pharmaceutical approach suggests that vitamin D might be a key piece of the puzzle.
Right. None of this is one size fits all. But from this study, it looks like older, overweight folks can see real benefits. Over a 12-month period, they saw consistent reductions in systolic and diastolic blood pressure. The results were particularly strong if you were already on the heavier side or already had hypertension.
And by strong, we're talking measurable improvements you can carry in your day-to-day life, like feeling less pressured, pun intended.
Exactly. Even small reductions in blood pressure can amount to big advantages for heart health. If you shrink your risk of heart disease, stroke, or kidney problems, that's a major win.
That is encouraging news. Yet I find it amusing how something as simple as stepping into the sunlight can have such a profound impact on complicated health issues like blood pressure.
Sometimes the simplest approaches are the ones we overlook. It's easy to assume the solution has to be complicated. But nature's solutions often are sitting right there, waiting for us to remember. That said, I love the detail about cutting back on seed oils because that's not something everyone thinks of when they run out to catch some rays.
True, a lot of people just think sun equals good for vitamin D. They never consider that the combination of a high seed oil diet plus UV exposure can lead to oxidative stress, so it's good to be mindful.
And as for high blood pressure, keep in mind that the simpler lifestyle adjustments can do wonders. Yes, medication can be necessary in many cases, but it's good to know there are additional tools in the box, losing extra pounds if needed, staying active, minimizing stress, and ensuring your diet promotes healthy arteries.
Did you say stress?
Oh yes, stress can spike blood pressure in a heartbeat. If you have a boss that reminds you daily that you're behind on something, your blood vessels might clench tighter than a toddler refusing vegetables.
Well, that's a colorful image. It's interesting how our emotional state can literally crank up internal pressure. It's like your arteries are listening to your thoughts. Oh, we're worried about deadlines? Let's just tighten up in sympathy.
Exactly. And it's that cumulative effect, high stress, poor diet, minimal exercise, plus unknown predispositions, that can push blood pressure from borderline to ballistic. That's what makes these vitamin D findings significant. It's a natural, relatively simple step that can take some of the load off.
So if I were to sum up the highlights in my usual straightforward fashion, we have about 120 million Americans dealing with high blood pressure. A huge number of them don't know it's there, so it's uncontrolled. That's bad news for hearts, kidneys, eyes, you name it.
Correct. And standard meds do help, but they don't tackle the deeper issues. Meanwhile, Dr. Mercola is pointing out that vitamin D supplementation, especially with calcium, has shown statistically significant drops in both systolic and diastolic blood pressure in older, overweight folks. The higher the dose, the bigger the drop in diastolic for many participants.
And it's not just short-lived. These improvements stuck around for a year, which suggests a long-term benefit rather than a quick fix.
Right. This is a highlight of a foundational approach. And let's not forget to mention how synergy with magnesium and vitamin K2 only amplifies the effect on heart health.
And for those new to vitamin D, the best method is sensible sun exposure. But if your personal environment involves a closet-like existence, or if you live in a land of minimal sunshine, a high-quality D3 supplement can help fill the gap. Just don't forget to test your blood levels so you're in the sweet spot.
Don't you love the idea that the world is constantly reminding us, get outside and let the sunshine do its work? It's as though nature's been sending us a memo for centuries.
Meanwhile, we're ignoring the memo because we're too busy hunching over our devices.
Precisely. Or we think we can outsmart nature by skipping the actual sunlight. Then we overdo it with a supplement or pick the wrong type altogether. Not to mention other critical nutrients that partner with vitamin D to do the real heavy lifting.
It's funny you say heavy lifting, because our hearts sure do heavy lifting every second of our lives. Maybe we owe them a bit more help.
Indeed. Especially given that so many folks are unaware they even have high blood pressure, it can't hurt to do the basics, like checking your levels. Blood pressure checks are simple. If it's elevated, you can dig deeper and see if vitamin D might be a missing link in your routine.
I do love when a plan comes together. Check blood pressure, possibly reduce seed oils, get some sun, add vitamin D3, keep an eye on synergy with K2 and magnesium, and hopefully watch that blood pressure head toward a safer zone.
That's the big takeaway. And if you're in that category of older, overweight folks, like the study participants, this could be a particularly critical step.
The cost of uncontrolled high blood pressure is huge, not just for individuals, but also for society. Billions in healthcare costs, millions of lives affected by heart disease, stroke, kidney issues.
Exactly. And so much of that heartbreak can be prevented if we catch high blood pressure early and adopt measures that truly support the body.
Now, if only we could harness the power of comedic timing to nudge people into taking action sooner.
We can try. I'm thinking an urgent comedy routine. Knock, knock. Who's there? High BP. High BP who? High BP, you better check me before I wreck thee.
Excellent, I can picture it already. But let's keep it classy. We're aiming for comedic sophistication, not a hospital nursery rhyme.
Fine, fine. I'll tone it down from nursery rhyme status.
As we near the end, let's recap. High blood pressure is rampant. Many don't know they have it. Medication can help, but comes with side effects. Vitamin D shows promise for real, measurable improvements. Pair that with other basic healthy habits, and you might just keep the silent killer from making so much noise.
Absolutely. It's a nice reminder that your body has an innate intelligence. Sometimes it just needs a gentle push in the right direction. Vitamin D, calcium, magnesium, and vitamin K2 can work together to help keep your heart pumping away at a more comfortable pace.
And the best part, you can start reaping benefits over the course of months, not years. It's a straightforward approach to a complex problem.
Indeed. So listeners, if you've learned anything today, let it be that a little sunshine and a well-balanced supplement plan could lower your numbers and lighten your health burden. And remember to check those levels periodically so you know exactly where you stand.
That's the essence of cellular wisdom, listening to your body and giving it the natural tools it craves. I think we've done Dr. Mercola proud with this one.
I sure hope so. I love how the simplest truths are often the most powerful. Well, that wraps it up for this episode of Dr. Mercola's Cellular Wisdom.
Join us next time as we dive into more health topics that might surprise you, or at least amuse you, courtesy of Alara's comedic intellect.
And Ethan's impeccable timing. Until next time, keep an eye on those numbers, soak up the right kind of rays, and nurture that marvelous cardiovascular system. Stay curious, everyone.
We'll catch you on the next episode. Take care, folks.
Bye for now.